Number two, not knowing your variables, right? This is second to most important. I actually was on a conversation with a very prominent pain person the other day, and we talked about laser, and I said to them something about, well, if you change your wavelength to this, and they said, wavelength? I just hand my patients to my technician and say, go treat, boop, 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 hit the buttons. And I'm like, oh my gosh, knowing the variables and understanding how to use them to the best of their ability makes a huge difference. So I put these two pictures in here. Why? One looks like it's a point and shoot. The other is done by someone who knows how to capture color and light and positioning and focus, right? That's the difference between point and shoot with a laser and knowing what you need to know to get optimum results. So let's look at some of our variables. Wavelength. Did you know that blue can be really bactericidal? Not all of the bacteria, but there's a lot of them, but you need to know how much to use. 600, that's our 400 range. Our 600 range is our red, which is awesome for any kind of skin lesion. So if you have a machine that has multiple wavelengths, you definitely want something red if you're going in to work on a skin lesion. 800-ish, and it could be 808, 810, 830, all of those have really good penetration through water. Why do I want to know that? Because if I have edema, I want to be able to go through the water to my target tissue, not get stuck in the water. 904, 905. Their really good thing is that they're super pulsed, which means they can have a lot of energy, boom, get into the tissue, better at getting through the skin, better at getting deeper, and because it's super pulsed, it's on for such a short amount of time, like 200 nanoseconds, tiny, tiny, and then it's off. So everything can cool. So you get really good penetration and never any heat. 970, 980, they have the best penetration through melanin. So if you have a black dog, that's a great thing. Skin more than hair, but both. Frequencies. Not only the number, because there's still some debate on that, but do you have a continuous pulse? Do you have a pulse, just pulse, which is gated, chop, modulated, on 50%, off 50%? Or do you have super pulse? And when do you use it so that you can get the best of that ability? I've got lots of studies in the course that talk about using, like changing one variable, like changing just the difference between the amount of power and having everything else the same and get totally different results. So you can get totally different effects depending upon if you're using continuous pulse or super pulsed. So you may appreciate my sense of humor. I'm listening, hence the dachshund picture, for more research to get more information on numbers. Most lasers have multiple ability to change power, right? So you can have a higher dose, you can have a lower dose. Class 1, Class 3, Class 4, they all have solid research behind them. So you need to know what they're best for so you can use it to your machine's best ability. There's tons of research, something as little as 100 milliwatts, 1 watt, even 12 watts.